Pregnancy is divided into 3 trimesters with distinct characteristics for mom and fetus. One characteristic that is common for both mom and fetus throughout all 3 trimesters is growth. During the 2nd month, the embryo is about 1 inch long and has distinct, slightly webbed fingers. Mom is experiencing morning sickness and mood swings. During the 4th month, the baby is about 2 inches long and is covered in a thick downy hair called lanugo. Mom is experiencing more frequent urination, heartburn, and shortness of breath. During the 6th month, your baby has started to practice breathing, and mom is experiencing more heartburn, varicose veins, and leg cramps. In the 3rd trimester, the baby grows to about 8 pounds and maybe about 20 inches long. All of this extra weight makes it harder for mom to sleep and move, and the pregnancy becomes exhausting. Deplenishing mom's resources. In the last few weeks, the baby drops in preparation for delivery. Premature birth is the birth of a fetus before the 38th week of pregnancy. Causes could be high blood pressure, cervical or uterine abnormalities, or heavy smoking and drinking. Nursing intervention is crucial to provide comfort and support during this time. A miscarriage is the loss of a fetus before the 20th week of pregnancy. Symptoms are bleeding, which progresses from light to heavy, severe cramps, abdominal pain, fever, weakness, and back pain. Labor is marked by 4 distinct stages, not to include pre-labor, which is known for Braxton Hicks contractions. The first stage of labor is when the cervix thins and dilates until it reaches 10 centimeters. The first stage has 3 phases: the latent phase, the active phase, and the transition phase. The first stage of labor is marked by the effacement of the cervix, the length of the cervix, and the dilation of the cervix. Nurses should be sure to monitor the fetus and monitor the mother, assist with maternal positioning for comfort and the administration of fluids. The second stage of labor is when the woman pushes to birth the baby. Here you'll monitor the station of the baby as it descends into the birthing canal and is engaged in crown and delivered. The nurse continues with maternal monitoring and fetal monitoring and assists with the delivery of the fetal and vaginal examinations as necessary. The third stage is when the woman expels the placenta. And the nurse will continue with the maternal monitoring and with the delivery of the fetus and monitoring of the fetus within the first few minutes after birth. The fourth stage of labor is the postpartum period. During this time, the nurses should be monitoring maternal blood loss and vital signs and providing fundal massages as necessary. In infants, physical development is marked by fontanelle closure, weight, length, and head circumference. Document physical growth as well. Motor skill development progresses from rolling over to crawling to walking. Piaget's sensory motor stage is marked by an awareness of self and object permanence. Infants develop at various rates, so don't be too alarmed if milestones are not met as expected. Monitor these milestones with your pediatrician. Infants are developing a sense of trust. Regular feeding schedules and home routines will help to develop the sense of trust needed for normal growth and development. Now that you are comfortable in this world, being a toddler is just a time for discovery and experiencing this world in different ways. New ways to move, new things to do, new ways to play, and new things to eat and eat and eat. Preschoolers have fine and gross motor skills that are developing in leaps and bounds. They are riding tricycles, skipping and hopping on one foot, and throwing and catching balls with ease. They are in Piaget's pre-operational phase, where their thoughts transition to intuitive thought around the age of 4 years old. They experience magical thinking and animism. Their vocabulary is increasing or will increase to more than 2,000 words by the end of the 5th year. They speak in sentences of 3 or 4 words at the ages of 3 and 4 years old. They are in Erikson's stage of initiative versus guilt, where they are energetic learners despite not having all of the physical abilities necessary to be successful at everything. They sleep 12 hours per day. During school age years, children are gaining 4 to 6 pounds and growing 2 inches each year. They are entering prepubescence. The difference in the rate of growth and maturations between boys and girls becomes apparent, where the girls are growing a little bit faster and maturing a little bit faster than boys. Immune systems improve, bones ossify, and permanent teeth erupt. They're in Piaget's concrete operation stage of cognitive development, where they transition from perceptual to conceptual thinking. They classify more complex information. They're able to see the perspective of others. They're in Erikson's industry versus inferiority psychosocial development stage. They develop a sense of industry through the development of skills and knowledge that allow the child to provide meaningful contributions to society. Peer groups play an important part in social development. Peer pressure begins to take effect. Clubs and best friends are popular. Most relationships come from school associations. By the end of the school-age years, children should eat adult portions of food. They need quality, nutritious snacks. During the adolescent years, sexual maturation is a big thing. There's breast development, pubic hair growth, axillary hair growth, and menstruation for girls. And for boys, there's testicular enlargement, pubic hair growth, penile enlargement, facial hair growth, and vocal changes. As far as cognitive development is concerned, they are at Piaget's stage of formal operations, where they begin to think in terms of abstract possibilities and hypothetical situations. In psychosocial development, they are at Erikson's stage of identity versus role confusion, where they're trying different roles and they become a part of a group, and this group greatly influences their identity and behavior. Psychologically, they are known for mood swings and variations in emotions and outward expressions of emotions. Their sleep changes. They're staying up later at night, they're sleeping later in the morning, and they are needing more sleep than their school-age years because of that increased metabolism and the rapid growth in periods of active growth. The image that they establish during adolescence is retained throughout life. Teenage depression is scary because children are gradually withdrawing from family, friends, and activities, and having feelings of hopelessness and worthlessness, and they have impaired or absent coping strategies, and they're crying out for help, and it's masked because these behaviors are typically associated with adolescence. And so we're not seeing the signs as being abnormal. That's why it's important for medical staff to provide thorough health histories and identifying a family history of depression and any perceived traumatic events in the eyes of the child, so that we can get the therapy and the medications necessary to get back on the road to a normal life. Everything is going on in my mind. I don't know what I did with it. I am so frustrated. Why is it so noisy in here? What is that up there? I wish she wouldn't get so angry with me. It makes me so frustrated. I wish he could see the potential in me.